Well, good afternoon. I'd like to begin by welcoming those members of the public and press who are watching the live stream of this meeting via Cambridgeshire County Council's website. There is always a risk that we may run into technical problems, and I would ask for your patience if we do. Should this occur, I will declare an adjournment while the fault is addressed, and the public broadcast will be paused. If it is not possible to address the fault, the meeting may be abandoned until such time as it can be reconvened. Can I remind members and officers that all virtual meetings are being recorded and that the recording of this meeting will be published on Cambridgeshire County Council's website. So if we turn now to attendance, we have received apologies from Gary Howsam, Darryl Preston, and from Councillor Richard Howitt, but however, he will be joining us later on in the meeting. Is that correct? Are there any more absences to record, apologies to record?
Not that I'm aware of, Chair.
I believe Gillian Beasley is unavailable, Councillor Walsh.
Okay. Thank you very much, as we add that to the record. So I will begin by calling the names of all members of the board to establish your presence for the record. Councillor Fitzgerald.
Yes, I'm here. Thank you.
Councillor Handley.
Present.
Thank you. Councillor Van de Ven.
Present.
Charlotte Black.
Present.
Adrian Chapman.
Present, Chair.
Joytree Attry.
Present, Chair.
Louis Camphor.
No.
He sent his apologies.
Right, thank you. And Wendy Ogle-Wellborn.
Present.
And Jan Thomas.
Present.
And myself, I'm Councillor Irene Walsh. So we have recorded those apologies. And at this point, can we turn to declarations of interest? Does anyone wish to declare any disclosable pecuniary interest or non-statutory disclosable interest at this point? No. Right, that's fine, thank you. And turning to the notes from the meeting of the 30th of April, we are being asked to approve the notes of the meeting on the 30th of April 2021 as a correct record. Can I ask anyone who does not agree with this proposal to use the raised hand function now? No, we're fine with that. Okay, so I see no objections to the proposal to approve the notes as a correct record, so we will take that as carried. And moving on in the agenda, I believe we have received no public questions. Could that be confirmed, please? I'm sorry, I see a hand
correct,
there.
Chair. There's also...
Could Val Moore please go ahead? I can see a hand.
Hi, I missed the register call. Val Moore from Healthwatch, member of this board.
Thank you very much. Thank you. We'll adjust that. Right, so turning back to the agenda then, item 4. Could I invite then Joytree Attry, Director of Public Health, to provide the board with a presentation on this item, please? You're on mute.
Yeah, I see that. Can you see the presentation?
Something is coming up on the screen. Yep. Yeah, I think that's fine. Yes, please go ahead, Joytree.
Okay, thank you. So this is UK-wide data, and it's showing that rates are remaining fairly low for positive tests and deaths within 28 days, as well as patients admitted, although we're starting now to see a small increase in all of those measures. In terms of vaccinations, across the UK, 80.1% have received their first dose, and 58.2% of the population, the adult population, have now received their second dose. And the map, the map there is showing that particularly for Cambridgeshire and Peterborough, the areas where there are increasing rates that are of concern to us are the Bedfordshire and London area. And we are seeing rates increasing there, and they're predominantly driven by the Delta variant. This is breaking down data for the Cambridgeshire districts and Peterborough. We can see again that rates generally are remaining low. Incidence rates are remaining low. We're just below England for all of the districts, sorry, east of England for all of the districts, and well below England rate in all of the districts and Peterborough. We are seeing a percentage increase, particularly in South Cambridgeshire, and in Peterborough, we need to keep an eye on the rates in the over 60s, but at the moment they're still small numbers and they're fairly sporadic. So we're not seeing large clusters or outbreaks, and we're not yet seeing a pattern, but we just need to keep an eye on that. And the positivity rates of tests are around 0.9% and 0.8% for Peterborough. And again, that's reflective of the number of cases that we're seeing. So this is further breaking down, visually showing the data trends, and we can see that the South Cambs rates for all ages are increasing. That's mainly driven by young people, and there's a chart later on that demonstrates that a bit further. And in the over 60s, as I've said already, we need to keep an eye on the Peterborough rates. This is demonstrating the same data, but for numbers rather than rates. And again, we can see just a small increase in the last few days for Cambridgeshire, and the same for Peterborough. This is the graph that I mentioned earlier. Essentially, the bluer and the darker the patches, the higher the rates. And what this is showing us is that for, I can't see the end of the graph because there's people, the rates are slightly older in the Cambridgeshire area than the Peterborough area. So in the Peterborough area, it's more school-age children and slightly older people who are acquiring an infection in the Cambridgeshire area. This is again showing test numbers and positivity rates for Cambridgeshire. The testing rates, the PCR rates, have been pretty static, and the positivity rates still pretty low. And I've said before, for Cambridgeshire it's 0.8%, and for Peterborough it's 0.9. And again, the testing rates are pretty static here, as well as the lateral flow rates. This is showing the number of people who have been hospitalised across the patch, and we can see that the rates are nowhere near where they were at the peak. They're very low. We're looking at 6 hospitalisations for COVID in the last period, so very, very low. Likewise with mortality, it's virtually non-existent at the moment. The last death in Cambridgeshire was on the 30th of April, and the last death in Peterborough was on the 16th of April. This is showing that is for deaths 28 days within a positive test result. This is deaths, includes all deaths that mention COVID on the death certificate, so a slightly different measure. But what this is telling us is that in both Cambridgeshire and Peterborough, the average number of deaths, the total number of deaths at this period is lower than the previous average for the previous 5 years. So we're seeing lower rates of death than we would expect to see for this period in time, this calendar period in time. So that's all good news. So in summary, we're seeing that a slight increase in numbers starting to take hold, also starting to affect hospital admissions and deaths, but the numbers are still very low. It's been driven by the Delta variant. Most of the sequence cases that we've carried out in Peterborough and Cambridgeshire show that they are Delta variant, so about 80% are Delta variant, and we know that that's much more transmissible than the Alpha variant. Rates in the over 60s are reassuringly low. We know that they're the highest risk group, but we are seeing increases in numbers in the 15 to 24 age groups in Cambridgeshire and 20 to 29 in Peterborough. Sorry, I got that the wrong way around. I couldn't see the end of the graphs. Testing remains stable, which is good. We want people to get their tests as a preventative measure. Hospitalizations and deaths remain low. Thank you.
That's the end of your presentation, Jyoti, is it?
It is.
Okay.
Yeah, I'm happy to answer questions.
Thank you. Right. If we could have that's it, normal screen back. And are there any questions that any of the members of the board would like to put to Jyoti at this stage? It's looking like quite reassuring news.
We need to keep a watchful eye on things, though.
Yeah. So I can see a hand. Yes. Charlotte Black.
I think it's useful also if we can continue to monitor infection rates in care homes, which I understand currently are really quite low as well, and aren't resulting in hospitalisations, but it would be good just to get a sense of everything I've heard recently has been reasonably reassuring on that front, but it would be good to cover that.
Okay, yeah. I don't have the data to hand, but we can look at that.
Yeah. That was a big issue from the beginning, wasn't it, Charlotte? So yeah, it's good to monitor that as well. Councillor Bill Handley.
Thank you. Yeah, I was just wondering whether or not we're keeping records of long COVID, because if you believe what you read in the press, younger people are more prone to long COVID. I don't know if that's true or not, but if it is, it would be useful to know if there are, increasing incidents of long COVID.
I think that's a matter for national and local study. It's certainly something that we're interested in. I think we need to be clear on what the symptoms are and how we're going, the case definition of long COVID, and we will work and follow national definitions and apply them locally.
Do you think the data's being collected, though? Any idea? Have you heard whether?
I think it's a matter of study. It's being studied.
It is being studied, right? Great.
Yes,
thanks.
yeah.
Yeah, thanks.
Yeah, it would be good to know when that data is captured and could be presented to make board members aware of that. Yes, thank you. Any more questions? No. Yes, Councillor Susan van der Ven.
Thank you. Yes, could I just ask you to tell us a little bit more about the increase in rates in South Cambs and Peterborough, because they stand out?
Yeah, well, more so probably in South Cambs, and the younger population. When we've backward contact traced, firstly, there's no discernible pattern, so there's no sort of outbreaks or clusters. They're fairly sporadic cases. When we've backward traced, and this is more the case for Cambridgeshire, what we found is that many of the cases have been associated with travel to London. And that may be part, I mentioned earlier in one of the slides that we need to watch out for the rates in Bedfordshire and London, because we do have transport links and other links to those areas, and travel to those areas could result in carriage back to Peterborough and Cambridgeshire.
Thank you.
Right, thank you very much. I don't see any further hands up, so I think with that we can move on to item 5, which is the update on the government's plan for roadmap. And again, Jyoti Attry, Director of Public Health, and Adrian Chapman, Service Director of Communities and Partnerships, will introduce this report. So over to yourselves.
Kate, are you able to present this one, or shall I fish it up? Great, thank you. Firstly, I'd just like to acknowledge that the content of these slides have come from Jim McManus in DPH in Hertfordshire. So with that acknowledgement, I'll talk you through the content. Could I move to the second slide? So as we know, the roadmap is going to remain in step 3, the same as the 17th of May, although there have been some changes to the restrictions, mostly around care home visits. So people can now leave care homes to visit family, and weddings and funerals. So the amendments, further updates that came on the 15th and the 17th were about the regulations required to manage weddings and funerals safely, the COVID restrictions, social distancing requirements, etc. Move on to the next one, please. So the reasons for not fully lifting the restrictions were to do with 4 particular tests, 2 of which were met, and they were that there's successful vaccine deployment and that the vaccine program is successful at reducing hospitalizations and deaths. Both of those have been met, but particularly for the latter one, it's the 2 doses that are particularly protecting against hospitalizations and deaths against the Delta variant. 2 of the conditions weren't met, and that was that infection rates do not risk a surge in hospitalizations causing undue pressure on the NHS, and that the assessment of risk is not fundamentally changed by a variant of concern. And of course, it has been changed because of the Delta variant. There were significant risks that if we proceeded to step 4, there could be an increase in infections, that the Delta variant is spreading. It's up to 60% more transmissible than the Alpha variant, and there is considerable transmission within households and between households. It's likely that even when we get to the 19th of July, there will be a level of background. We will still have COVID. It won't have disappeared by the time we get to the 19th of July. But it gives us a chance to accelerate the vaccination program, offering greater protection to our population. And the government has announced its aim to ensure that every adult aged over 18 has received at least their first dose. Of course, this will be kept under review, and in 2 weeks' time, the government will review their position. Could I go on to the next slide, please? In terms of the limit, or the lifting of the limits, the changes that have been made since the last review, the limit on weddings of 30 people and funerals has been lifted, but risk assessments still need to be carried out. Venues need to make sure that they are adhering to COVID restrictions, that the venue can allow for social distancing, and actually the capacity of the venue, or if the wedding is held in a private setting, the capacity of the private setting could limit numbers. And that all needs to be considered when planning. There are still pilot events continuing around sporting events and musical events, and we will learn from these. Of course, there's testing. You either need to demonstrate proof of vaccination or a recent negative test to gain entry into some of these events. And care home residents, I mentioned it earlier, won't need to isolate if they leave their residence, with the exception of high-risk visits, for example, overnight stays to hospitals. Can we move on to the next one, please? So I think I've covered a lot of this already. There's concern about hospital admissions, which are rising slowly. They're still at a low level, but we need to keep an eye on this. There's concerns about long COVID, as you mentioned, which are a particular concern at the moment for younger people. It's important to keep the infection rates suppressed until we can get more of our population vaccinated. And I mentioned earlier that the 2 doses are particularly effective against hospital admissions and deaths for vulnerable populations, against the Delta variant in particular. But of course, the more we can vaccinate and the more we can suppress transmission, the less risk there is from new and unidentified variants of concern. The following of personal protective measures and other prevention measures remain important. So ventilation of venues, meeting outside where possible, the testing regimes, hand washing, mask wearing, etc., are still really important, an important component of our measures to prevent the spread of COVID. I'll stop there and invite any questions that you might have about that.
Thank you. I think I have Adrian Chapman also down to speak.
That's right, yes, sorry.
Yeah.
Great, thank you. No problem, Josie. And thanks, Councillor Walsh. Afternoon, everyone. So I was just going to add a verbal update on the work that we're doing wrapped around everything that Jyothi's described for us today, and just really to give reassurance to the board and to our communities. So the numbers, as Jyothi's articulated, are looking really quite promising, and rightly Jyothi's expressed a need for caution and observance on those numbers. And I just wanted, first of all, to reassure the board that we continue to apply due rigour to the epidemiology. We review the epidemiology in some detail every single day, and arrangements working through with our partners remain stood up across our system. So whilst numbers are looking good, it means that should we find ourselves in a situation where the Delta variant or any other variant starts to impact on our county or Peterborough, we can respond extremely rapidly. Now, that's the first thing to say by way of reassurance. Just because the numbers have fallen to where they are, we have not at all taken our foot off the accelerator in terms of maintaining momentum. But deeper than that, I just wanted to also assure the board that the arrangements across our district and city councils and with our voluntary community and faith sector partners remains as robust as ever. And in fact, I would probably go further and suggest that it feels like those arrangements are becoming part of our normal ways of working going forwards. I think we all know that COVID will be with us probably in perpetuity, and it needs to be managed in the way that many other conditions are now managed. But actually the learning we've gained from the last 18 months, and I've reported to this board a number of times on the success of those relationships, has become such a powerful feature of how we need to work together around our communities, with our partners and supporting vulnerable people, that the will is certainly there to maintain that way of working as a permanent feature. So the Community Resilience Group that I've reported to you before actually continues to grow. Our district and city council colleagues all still have their rapid response arrangements in place, supported ably by Jyothi's team and other agencies such as the police, the wider health system, the ambulance service and the VCS, as I've mentioned. Our themes also remain, even though the numbers are relatively low, on ensuring good quality outbreak management, forward and backward contact tracing, as Jyothi's mentioned, but really getting a grip on an outbreak before it can get a hold. And as part of that, to encourage take-up of testing, to encourage self-isolation, and where self-isolation is not practical for somebody, perhaps because they'll lose earnings, for us to remove those barriers and put in place measures that enable self-isolation to happen. And more recently, to support Jan and her colleagues to increase vaccination take-up. And Jan will report on the very successful vaccination programme in the county shortly. We're supporting that work with work to increase take-up where we need to. And finally, just to wrap up by confirming that the network of hubs that we've established, centred on the Cambridgeshire and Peterborough hubs, will also continue as a permanent feature of the way we operate across Cambridgeshire and Peterborough. They've become a vehicle really for people to make contact, hopefully way before more complex needs emerge. So having that ability to make contact with a service at the earliest possible opportunity has proven itself to be invaluable through the pandemic. Why wouldn't we want to continue that as a permanent feature of the way we operate? So I can absolutely confirm that that hub arrangement will continue way beyond, but also incorporating COVID needs as we progress forwards. So that's my update, Councillor Walsh, just for reassurance alongside the data that Jyoti shared today.
Thank you very much then to Jyoti and to Adrian. Yes, there is reassurance. I think we actually begin to feel that there is going to be an end to this story, or at least a conclusion we can all live with more comfortably. Thank you very, very much. So over to members of the board now for any questions. If you could raise your hand, or if you'd just like to make a comment, please feel free. Yes, Councillor Van der Ven.
Thank you. No, thank you for all of that information. I wanted to just make a couple of comments and questions. Firstly, it's really good to know that the county-wide hub system is in place and will continue. And I'd like to say how helpful the information has been that's been filtered down through the districts. And in my case, it's South Cambs, and I'm delighted it's happening everywhere. But this is so effective. It does reach the local volunteer groups who are on standby and actually doing still some very important casework. And those links around support for people who are self-isolating and so on are really important and are being acted upon. So I hope that there will continue to be a regular flow of information in that way. And then I have a question from the community about, you've talked about the importance of reporting on rapid flow testing and the fact that the NHS COVID app is not the friendliest app, and it doesn't actually make it as easy as it could. And I wonder if that's feedback you get from elsewhere, or if there's some way of feeding that into the system. You have, yeah, I'll leave that with you and happy to talk about it outside. But I don't think we're getting, anecdotally, that just crops up. And if that's important, then we need to take note.
Right, thank you, Councillor. I think, Adrian, that's not something that you could address at this moment. So.
No, I think that the latter point, sorry, Councillor Walsh, to interrupt, the latter point, I think Jyoti will acknowledge, I think, and will take away, perhaps pick up with Councillor Van der Ven offline. I did just want to quickly respond, though, to the Councillor's first point around the community response, which has just been staggering, as we know, and overwhelming. Communities didn't wait to be asked, they simply stepped forward. And a bit like many people in our system, a lot of them are exhausted, but continue to really meet the needs of their neighbours, friends, colleagues, families, and so on. And I'm in awe really of what's done in a voluntary capacity across our county. The reason I just wanted to respond is because I think it's also going to, we need to continue to support our communities to respond in that way beyond the pandemic itself, because we know that recovery from the pandemic will be a lengthy process. There are lots of people, we mentioned long COVID first of all, but there are many other impacts of the pandemic on people who are vulnerable. And we know that isolation, has increased. There are concerns around mental health prevalence, economic impacts, and so on. And I just think with and alongside our communities, together we can do so much to support those people to get back to a better state than perhaps they are currently. So we don't take it for granted. And thank you for the comments. I'm sure Christine noted them around the information flow to communities. It's so vital, and that will absolutely be continuing.
Thank you very much. Thank you. Councillor Handley.
Yeah, thank you. I think in Cambridge and Peterborough City, vaccine hesitancy can perhaps be put down to cultural, not always, but in some cases, cultural or religious issues. But I think in the rural areas, one of the major reasons why there's hesitancy, it's not so much hesitancy, it's actually the physical difficulty sometimes for people to actually get to vaccination centres. And I'm just wondering if there's any scope to take the vaccine out to the villages, because you capture a lot of people if you do that. And also, if I could just make another point about the communities thing. I mean, we've got a really good network in South Cambs, and I'm sure other district councils are doing a lot of work with their community volunteers. Really happy to work with the county as much as we can to try and secure the effort going forward. That's just a comment. Okay.
Okay. Thank you very much then. Shall we move on, or are any officers wanting to address the, yes, Wendy, would you like to come back on that?
Thank you, Councillor Walsh. I just wanted to not come back on that point, but the wider point, just to say that I think it's really worth noting, really linked to what Adrian said, that with the development of our integrated care system across Cambridgeshire and Peterborough, what we have done is we've ensured that there's representation from the North and South alliances, which will become the integrated care partnerships, actually sitting on our place leads group, actually support the community resource group. So we are joining all of that up, and I think that's really important that people know that.
Right. Thank you very much, Wendy. Thank you.
Sorry, Chair, before we move on, could I just ask again that, are there plans to have perhaps mobile vaccination going out to the rural areas to capture those people who struggle to get about? The public transport can be atrocious in the villages, I'm sure you know. It's important that we capture everybody. That's actually a question I'd really like you to address if you can.
Is this something that we ought to hold for the next item, or is it? Yeah, because the next item,
I was just going to say it'll be addressed in the next item.
Yeah,
all
the
right,
vaccination programme, so it may be answered, or if it's not, then we'll put your question again. Okay, any more questions on item 5 then? I have Val Moore.
Thank you, Councillor. It was just in response to what's previously been said about access out in the communities, and just to say we do have contacts from people who come to Healthwatch when they can't get immediate joy from who they think they should talk to, but we are still hearing from the occasional people where logistics to getting vaccinations is a problem. But it's swiftly resolved as soon as we've put them in touch with the CCG colleagues, and likewise some people who are housebound have been swiftly responded to by the CCG and the CPFT to go and vaccinate them in their house. So we're not hearing a massive frustration around that. Not to say that isn't the case. Most of our intelligence about issues coming from the communities is actually focusing on the consequences of COVID in terms of frustrations about accessing GP appointments, dental care, and confusing letters about appointments or reappointments and matters to do with information about their treatment and care when the waiting times are being stretched. So it's more the consequences that we're hearing about rather than the vaccination programme. So I just thought I'd mention that because it was raised in this section, but I know Jan's got her update for us to come. Thank you, Chair.
Yeah, I jumped the gun a little bit. Sorry about that.
Yeah, that's fine. So I think also perhaps communications is another aspect of this, because if there is availability of facilities, the public needs to know about it. So we'll see when we get to communications whether that is addressed or ought to be more widely addressed. So with that, then, if we can go to item 6 in the vaccination programme, and Jan Thomas will be presenting this.
Yeah, good afternoon, everybody. Where we're at with the vaccine programme. So is it helpful if I share some slides? Would that be okay?
Yes, indeed, please do.
Now I've got to work out how to do that. Share screen. This one. Can you see that?
No, not at the moment. Does anyone else have your presentation? There we go.
Is that there now?
That is there, yes.
Excellent. Okay, thank you. So so forgive me, this is something that I've been walking people through this week, just to make sure that we're all on the kind of same page. So where we're at, we are in the midst of a really deep dive review on the programme. I describe us as being now in a different phase of the programme. First of all, it was all about cohorts 1 to 9, how many first jabs could we get in. Then it was really push on second jabs. Now it's refining, really nailing down where we are with second jabs for cohorts 1 to 9, and then really getting the volumes of first jabs for everybody else outside of 1 to 9 before the 19th of July. That's the ask. And also there's other asks coming through, for example, like the mandatory care home workers to be vaccinated within a 16-week period. So that's the series of asks we've got now. Our strategy is a 3-tier approach, just to absolutely remind people. The first one is this weekend and next weekend, we're starting our surge capacity walk-in vaccination centres this Saturday at Thomas Walker. And then the following weekend in the Peterborough Stadium. They are big walk-in events for large volumes of people who just, if they want it, turn up. It's open now to all over 18s. Come and get your first jab. So those big surge events, so that we can get 1,000+ vaccines done in a day, is kind of part one of what we're doing. Part two is making sure we have a core of bookable or other walk-in capacity for people's convenience. And this is really provided in 3 different ways. The first one is that we've obviously got our GPs that are delivering. We are reducing down that because GPs had an option to opt out of carrying on with the vaccine programme. So we've had a number of them pull out because of the pressures on primary care. And I know Val mentioned it, but I do want to say, this is all in the context of healthcare is under huge amounts of pressure at the moment. The volumes that we're seeing through hospitals, through GP practices, and I know you're feeling that in care as well, but it is really high. So we've got some GPs absolutely supported by us, saying we need to prioritise getting our GP services right, and we're going to be doing that. So we're stepping up, therefore, more capacity in the vaccination centres. And they're the ones that are run out of places like East of England Showground and the City Care Centre, to make sure that we have that core of capacity. And also we've got a series of pharmacies that are all able to deal with either booked appointments or walk-in appointments for vaccines as well. So you've got the big surge, then you've got the weight of all bookable with a handful of walk-ins that can happen in that big core capacity. And that is where the vast majority of our vaccine delivery happens, is in that middle bucket. And then there is the bespoke targeted work that we need to do. And I'm sure Adrian can walk through more of the details of that. But that is how we do, that's how we do the more personalised street by street, checking if people have had it, if haven't, trying to get them into the vaccine centres. And I believe the first week of July is the arrival of the much anticipated vaccine bus to enable us to get out and into different places around the county. So we really are trying to make sure we hit all three of those levels. One of our biggest challenges is making sure it's not about vaccine supply at the minute, but it's about alignment of vaccines. So as you go down the cohorts, obviously, that is not about using our AstraZeneca stock, it's about using our Pfizer and Moderna stock. So we've got to make sure we've got the right type of vaccine in the right place, depending on if it's first or second appointments, and make sure the bookings happen accordingly. And that all of that is also happening alongside us thinking about what we're going to do about boosters, how do we line that with flu, and what we're going to do when we get the call to arms on the under 18s. So that's kind of what we're trying to do. Where we are in terms of overall delivery, we are kind of on the latest published data. I don't think this is yesterday's data, by the way, just because we just haven't quite caught up yet. But we are kind of middle of the pack for first doses and second doses. I should explain Cambridge and Peterborough is the green here, and this is all the ICSs across the country. But we have a problem, and I think you would all recognise this problem, which is if we go down to look at our aggregate numbers, we'd go fine, absolutely fine, but we have huge variations at medium super output areas. So what this dot diagram shows is the red dots are all medium super output areas across the region. The blue dots are Cambridgeshire and Peterborough. And what you can see through this with the cluster, whilst we have a lot of practices that are over the East of England uptake percentage, actually we have a significant amount in specific geographical smaller areas where that number is significantly lower, particularly certainly in centre of Cambridge and Peterborough, we have specific medium super output areas where we have low uptake. So the message is generally, if you look at the aggregate numbers, all's going well. What we need, but when we look at the medium super output areas, we have to be really targeted now to make sure that all of the capacity we've got, we're working incredibly hard with your teams locally and the communities work to say, how do we really target now these communities into the capacity that we have put on? I'm going to be very blunt about it. We don't have all of the workforce that we would need to do very bespoke solutions in every area that's got a problem. Actually, what we need to do is very much work to how can we work with the districts, Adrian, all of your teams to say, how do we get people to know where the capacity is available and get people to it, rather than focusing a lot of time on getting the teams out. Although, of course, as I mentioned before, we do have the vaccine bus. I have to say this is a hugely challenging programme. We think we have done a lot of work in the last 48 hours to really drive to make sure we can hit that 19th of July target, which is everybody over 18 with being offered a jab for the first dose and getting as high as we can on the second dose work. So we think we can get there, but I'm not going to stand here and say I'm 100% confident, because I can put on all the capacity that we need, but we need to get people into the slots with the jabs in their arms, and I think that's the challenge for us now. We really need to focus on getting all of the capacity used. I'm very happy to walk through the specific numbers, but what I will say is when I look at the second doses for cohorts 1 to 9, and if you remember, I was very obsessed over the last few months with making sure we got good coverage on 1 to 9, because that's where the actuarial physical harm risk sat in the profiling. I'm able to confirm that for the over 80s, we're over 95% for second doses, also for the over 75s, 94% for the over 70s, 90% for the over 65s and 85% for the over 60s. So you can see on second doses, because we've been really targeted in making sure we'll get those most at risk of getting very sick, those numbers are very specifically high. And when I compare Cambridge and Peterborough to other areas, what I would say is we've got much higher concentrated in those 1 to 9, and we've got far less spread down the cohorts than other areas which have got more in the other categories, but not as much in the second doses for those 1 to 9s. But I'm able to confirm that this week we've passed the £1 million dose, gone through the 1 million dose administered to people in Cambridgeshire and Peterborough. So that's quite a brilliant milestone.
Well, Jan, thank you very much. It's a race against time, and I can see that you're really running it. I'm sure you're feeling it. And thank you very much for your efforts. I think it probably wouldn't be right to ask you to give any more detail at this stage. Otherwise, we'll run out of time in the meeting. But should anyone want that, I'm sure you'd be happy to provide it. I would just quickly like to refer to Adrian, because there was mention of the difficulty of certain communities, and whether you have any comments, Adrian, you'd like to make in that regard.
Yeah, thanks, Councillor Walsh, very much. So we have stood up a vaccine, what we're calling a vaccine confidence steering group, accountable to the CCG who are leading the programme, but bringing together people with expertise in addressing the needs of vulnerable, isolated, marginalised, excluded groups, or for parts of our population that, for reasons that Councillor Handley mentioned, are isolated, for example. That group meets weekly. It comprises representation from every district and city, our 3 councils of voluntary service, and obviously our health colleagues. It's a very dynamic group, very proactive, very responsive to the changing data. We get fed an incredible amount of really rich data from Jan's colleagues, which is really starting to help shape and inform where we need to focus our effort. What you'll start to see, I think, in the coming days is a real drive at district and city level to start to drill down to those MSOA levels, the tier of measurement that Jan's described, because that's where we can really start to make a difference. So smaller geographical footprints, but where we know there might be an issue around take-up. And the confidence work falls into 2 categories, really. There are the structural barriers. Bill, you mentioned some of those around transportation, getting to and from. Perhaps you're a carer, you might not be able to get out. We know that people can't sometimes or won't want to leave work to get vaccinated, especially if they earn money based on productivity and those kinds of things. Lots of solutions being put in place. The bus coming in July, we're all looking forward to that, but we've also run a number of pop-up sites and tested out different ways of setting up a very ad hoc almost arrangement. So pop-ups in mosques or church venues, pop-ups in employers that we know employ people who might be in those hesitant groups. Lots of different ways of just trying to engage people. And then on the other category of our confidence work relates to hesitancy around belief and myth often. So where people get their information, what they believe on social media. There are still, believe it or not, people who think that the vaccine is an attempt by government to track them. These are all, beliefs that people hold, and we have to work through those with people rather than just dismissing them. So. And you mentioned, Bill, the issue of hesitancy perhaps being targeted towards different parts of the population. In actual fact, in Cambridgeshire and Peterborough, there isn't a huge amount of hesitancy. That's the first thing to say. And what we're seeing is if we can start to tackle the structural issues, actually the general levels of take-up, as Jan's already articulated, is doing really well. But where we have got hesitancy, especially related to people's perceptions, it's fairly well distributed across the demographic. There aren't really major pockets of hesitancy that perhaps you've seen elsewhere in the country. And we've anyway got a fantastic network of of colleagues across the system who are working with different groups, wherever they might be, to try and dispel some of those concerns. So I think we're in a really strong place, and I think the kind of work that Jan's been leading this week to look to the next surge, the next wave, ready for that stage 4 reopening. I feel a real sense of optimism that we've got all of our ducks in a row here, and just need that final push to get over the line at a decent level.
Thank you very much, Adrian, for that extra information. Councillor Handley, did you have a question you'd like to come back on?
Very, very brief, Chair. I appreciate we're running out of time, but first of all, can I say I'm reassured from the comments on, getting to those hard to reach places. Thank you. The other thing is, can I please just exploit my privileged position and actually thank everybody that's involved in this response, which has been truly amazing, particularly Jan and colleagues. The vaccination rollout has been stunning, and I know that if you were to come to my village, you'd get big hugs, I tell you, because it has been fantastic. Just thank you so much.
Thank you very much, Councillor Handley, and I must say I echo those views. I'm sure that we're all so appreciative of all the hard work and the long hours and the anxiety, and they all deserve a brilliant holiday when things get a bit easier. Charlotte Black, Charlotte, would you like to add something to the discussion?
Yeah, just very briefly, just to flag that obviously there's been the recent announcement this week about care home staff, the requirement for them to be vaccinated. We're awaiting the detailed guidance, I think imminently, in terms of what that actually means in practice, but it's a sort of double-edged sword. So we do have a small number of care homes where the vaccination rates continue to be concerningly low. So at one level it will be great because actually it will be unavoidable, but then there's a distinct possibility we lose quite a lot of those staff. So it's a really tricky one. And I guess what I'd like to raise with the board is just a request that as things change and the pandemic moves on, that we're particularly vigilant about those care homes where the community around them, the infection rates seem to be going up, because all the evidence so far is that the transmission is probably as a result, and obviously now care homes are becoming much more open, as I think they need to be. There is a distinct risk for some of our care homes where the vaccination rate hasn't been, and it's not because the offer isn't there. The offer is very much there, and people have gone to great lengths to make that clear. And Public Health and others have done lots of bespoke work with those, but it's a very deep-seated resistance, really.
Thank you very much for that, Charlotte. Yes, it's very concerning, I think. Right then, I think we need to move on to the final meaty item on the agenda, which is the communications briefing. Christine has helpfully provided us with a document which we've read, or is it just me? Anyway, Christine, over to you to make presentation.
Yes, I can do this fairly briefly. Presentation. I won't do death by PowerPoint to you in the final 2 or 3 minutes of today's meeting. But I just wanted to highlight which about through and do tell me if I start getting dark. Camera.
Yes. Sorry, Christine. Sorry, Christine. Your voice isn't coming across clearly. I wonder, could you switch your camera off, and your voice may be a little bit better for us.
Is that better? Sorry. Yeah, it does do that, I'm afraid.
That is better.
Okie dokie. So just to say that the priorities that we're working on for communications, you can have a look at the background through the report that I've provided, which is in the minutes. But our current priorities at the moment are obviously working very closely with our CCG colleagues around vaccines. So actually supporting, particularly around people getting the second doses. We are looking at more campaigns at the moment about one jab is only half the job, which we want to take out into some of the areas where people are have had their first one and for whatever reason they're not coming back for their second one. We also want to do more, and we will be doing more work across the summer around the rapid flow tests and people getting their PCR tests. So again, a lot of that work is going on. And we are working very specifically with younger people. So what we do know is that, we are getting through data a fair picture of the fact that younger people, and they won't be vaccinated, under 18s are not on the list to be vaccinated, but that's where we are seeing infections. So actually working with young people themselves to do more peer-led materials about how they can actually support and still have a summer. So we're looking and we're working with Anglia Ruskin students, we're working with City of Cambridge students, we're working with the Peterborough Youth Forum, we're working with Cambridge City Council with their youth forum to do a whole series of peer-led interventions with young people, and obviously I know that everybody's very appreciative of Councillor Hanley's offer to give people a hug, but what I would actually say is please don't give anybody a hug just at the moment, unless you live with them in the same household. So actually so our whole communications approach has been very much about what can you do safely, and the biggest thing you can do is get your vaccine. So we're doing an awful lot. We've launched a staff campaign this week across Cambridgeshire and Peterborough. It's open also to staff in all of our other public sector groups, so that staff can actually talk to people about those hesitancy or confidence issues. We're working with the vaccine confidence group, and there is a training session. There's a toolkit that people can use. We've got email signatures that people can use to actually get people to say, join the thousands of people across Cambridgeshire and Peterborough who've had their jabs. So we're doing an awful lot of that work, and we're doing a lot of work to say how people can actually live and how they can have a more normal life in a sensible way. Because again, all the evidence that we can see, all the evidence we're getting from SAGE, from behavioural scientists, is actually people are getting fed up. They want to live a life. They think that it's maybe more or less over now, and their guard is starting to slip. We need them to carry on doing the right things, and that's what the focus of our messaging is going to be. A lot of the work that we've done over the past 14, 15 months, it's been really fast, it's been really innovative, it's been really turning around, but it's all work that we can use for all of the campaigns that we do across public health from now onwards, and all the campaigns, in fact, that we do for the council more generally, all the innovative techniques that we've been using, all of the communities and all of the really good relationships that we've built. So whilst it's been a ghastly time for everybody, actually in terms of work and the work that we're going to do going forward and the relationships we've built, I think it's been unequalled. So very happy to take questions, and if anybody wants to contact me outside the meeting, I'd be very happy to help.
Thank you very much, Christine. I think we all deeply appreciate the work you and your team have done throughout the pandemic as well. It has been a very tough time for yourselves getting those messages out. So are there any questions to Christine at this stage? No, you seem to have escaped questions, Christine. So I think with that, really, we're on to our last item, which is any other business. I can't see any hands going up to raise any points on that.
Can I just advise Christine that the hugs will be virtual, or rather socially distanced, okay? I get it.
Virtual hugs. Do they have those? I know they have hand clasps, but I haven't seen a hug yet. They ought to have them, you're right. Anyway, there we are. So I think we've come to the end of our meeting. The date of the next meeting will be confirmed with you outside of this meeting, and otherwise I wish you all a good afternoon, good evening.